Dr. Sangeetha Venugopal, thank you so much for coming to the first annual HemOnc Pulse podcast meeting. Really appreciate it. So we just finished the session on the unanswered questions in CML. What were your takeaways in terms of what are these unanswered questions and what we're going to focus on in the next couple of years?
Thank you for inviting, and it was a pleasure. And I think the unanswered questions are, we still have to find out the appropriate treatment for CML blast phase, because we do think that the CML blast phase, which is either myeloid or lymphoid, is a completely different disease compared to the de novo AML, even with the BCR-ABL translocation, or an ALL with BCR, Philadelphia positive ALL. So we don't have standard of care therapies. Right now we are treating them as de novo AML or de novo ALL, but the outcomes are really not up to the par.
Despite that treatment.
Yeah.
And how about lots of discussion that took place on the kind of first line chronic phase CML, because there's about 750 TKIs right now,
yes,
right? Something
correct.
like that, yeah.
Yeah. So it's Imatinib, dasatinib, bosutinib, nilotinib. So those are the first line TKIs most likely we see. But then in our practice, we do second generation TKI. Again, it comes down to the insurance approval. So Imatinib is also approved in the first line, and Imatinib can be obtained as generic, and dasatinib is still it's not yet generic yet. So sometimes when we start the patient on dasatinib, we don't get approval right away, and we have to go for patient assistance program and stuff like that, so that the patient doesn't have a copay. In that case, sometimes we still go to this generic cost plus pharmacy and say like, okay, this is easier. If sometimes even the insurance doesn't approve the Imatinib, so we just have to go for, okay, this is easier to get. It's about like $400, which is not as bad as paying $3,000 per month for the drug, which they have to take for about 4 to 5 years, at least continuously, if you're thinking about treatment-free remission.
Yeah. Well, look, I think CML is the prototype of success treatment of any type of cancer. Thank you for being part of the panel. Look forward to other questions and more answers in the years to come. Thank you so much.
Absolutely. Thank you for having me.
Yeah.